Today we're talking about TMS and how long does it take before it works. If we haven't met, I'm Dr. Orlando Landry. I'm a physician that specializes in interventional neurosciences and how to be able to help heal brain and body so that you can be able to lead the life that you deserve. Today we're talking about TMS, which stands for transcranial magnetic stimulation. If you haven't heard of it, that's not that uncommon. There's a number of people that haven't, but it's a therapy that's been out since 2008 with FDA approval for being able to treat a number of different conditions, but specifically treatment-resistant depression. Today, we're going to talk about how that impacts what TMS is and how long does it take before you can really get relief. But let me just give you a quick spoiler alert. It's faster than what you might think. So normally when we have to wait for things, whether it's a stop sign or whether we're having to wait for time to pass, it traditionally is an annoyance because we're like, we want what we want when we want it. But the fact of the matter is, when we're dealing with things that are critical, that impact our lives, sometimes it's really worth the wait. And when we look at depression, we know that it impacts individuals from across the globe. And the fact of the matter is, when we take a look at how impactful it is, it's the leading cause of disability in the United States for individuals 15 to 44. In addition, it also is related to suicide, and it's the second leading cause of death for those same age group. So when we think about how can we be able to impact patients, be able to give them their lives back and be able to improve things, frequently we're thinking about physical ailments, traditional things like cardiovascular, pulmonary, potentially cancer. And those are important conditions, make no mistake about it. But many times we don't really give mental health and depression its due diligence and due respect. And in this regard, we really kind of fail a good number of people. More than 2/3 of people with depression do not seek or receive proper treatment. And when we talk about the workplace and how it's affected, it's hugely affected. Depression ranks among the top 3 workplace issues in the United States in terms of impacting work being able to be delivered. So when we look at different studies from everything from the Harvard health blogs to other scientific studies, we get an idea about TMS and how impactful it can be. So TMS itself is utilized and is helpful in about 50 to 68% of patients who don't really respond to traditional therapy. And of those, about 1/3 of those who are treated with TMS improve to the point where they don't need any further treatment. So 30% of patients that are treated get completely better and never need medications going forward. And of those people who are treated with TMS, approximately 60% improve at least somewhat. And these are people who failed other medications and didn't have benefits from traditional treatment. How does it work? It works by using magnetic fields to be able to stimulate brain circuits. And these brain circuits are the circuits that are involved in mood regulation. Traditionally, it's deployed in by utilizing a treatment that's 20 to 30 minutes. It's 5 days per week. And in average, it lasts from anywhere from 6 to 8 weeks. Now, let me make a quick divergence. Although this blog doesn't necessarily talk about it, there's an accelerated type of treatment that's present. That was actually put out by Stanford that can be done in the course of a week, which is a little bit different with the longer time frame with number of treatments delivered per day. And actually, as a matter of fact, its degree of effect even works faster, but we're going to come back to that at a later point in time. So when we think about TMS as a whole, one of the things that we know is that when we look at what studies have been able to kind of show how quickly does it work, well, there's a study from UCLA that looked at how it responds to major depressive disorder. And what they found is that it started alleviating symptoms as quickly as 1 week. When you talk to most TMS providers, they'll tell you, well, it may be about 10 to 14 days. But when we look at the studies, and you can see this graph that's present here, we can see that this is measuring one of the depression scores, a HAM-D, and you can see where this starts in terms of the number, and you can see that there's an improvement, a marked improvement within the course of 1 week. Now, it continues to get better, so much so that many times patients start to notice it around the 2nd or 3rd week. But most of the time, there's some improvement within the 1st week. A different scale found the same thing. So the first was a HAM-D. This is a MADRS score where you can see the similar type change, different questions that are asked, different evaluations. So at the end of the day, if you want to know, can TMS be able to improve you? It probably can. And can it be able to improve depression quickly and rapidly? As a matter of fact, it can. So when we think about how this can be impactful, incredibly exciting. As I kind of gave a little sort of sneak peek, when we talked about accelerated, that treatment that takes place over 5 days, they started seeing improvement somewhere between the first and second day in that treatment, but there's many more treatments that are delivered. If you found this interesting, give us a like. If you want to learn more about different topics that allow for you to be able to lead the life you deserve and want to do the things that you want to be able to do, please subscribe to our channel so we can be able to help you figure out how to be able to punch pain in the face, whether it's physical or mental, and get back to leading the life that you deserve. Thank you so much and have a great day.